5 health tests to avoid after 70 that might do more harm than good. There's a quiet truth many older adults will never hear from their doctors. Every year, countless seniors line up for routine checkups, believing they're staying ahead of illness. But what if some of those tests, the very ones your doctor recommends, might actually increase your risk of surgery, stroke, or even cancer? Recent research shows that nearly 37% of medical testing in older adults leads to unneeded treatments, complications, or long-term side effects. Even more surprising, nearly 99% of people over 70 don't realize they may be getting tested too often. One of the exams on our list, the one ranked number 1, has been linked to 5% of cancer cases in the US, which is the same risk level as drinking alcohol daily. You won't hear this at a clinic or see it on a health ad, but the data is out there, and today we're bringing it to light. In this video, we reveal the 5 health screenings to avoid after 70 and the shocking reasons why. Each one is backed by solid research, and you might be surprised by what ends up at number 2. Before we jump in, tell us in the comments, where are you watching from? How old are you? And have you ever had a test you later regretted? Do you think the healthcare system is over-testing seniors? We're reading every comment and offering personalized advice. And if you like this kind of content, make sure to like the video and subscribe for more insights like these. Let's start with the first checkup, and why something that seems so simple might quietly reduce your quality of life. Test number 5, bone density scan. This test sounds completely safe. Just a quick scan, no pain, and no needles. You leave the clinic with a sense of how strong your bones are. But after 70, this scan can cause more fear than benefit. Known as a DEXA scan, this test measures bone strength and is used to look for signs of osteoporosis. But in older adults, especially women, the results almost always show some bone loss, even if there's no real threat. That's because losing bone is a normal part of aging. Like gray hair or wrinkles, it happens to everyone. Still, many seniors are prescribed medications like bisphosphonates, drugs meant to increase bone strength, but known to cause harsh side effects like jawbone death and inflammation in the esophagus. Here's the concern. Studies show that treating mild bone thinning in people over 70 with these drugs doesn't significantly lower fracture risk. One study from the Journal of the American Geriatric Society followed over 1,200 women past 70 and found that bisphosphonates reduced fracture risk by only 0.3% over 5 years. Not nothing, but not a game changer either. And unfortunately, those same women were more likely to develop side effects from the medication, including digestive problems, throat irritation, and oddly placed fractures. Take Linda, a 76-year-old former dance teacher. She was sent for a DEXA scan at her yearly visit. She'd never fallen, had no bone pain, and took daily walks. Her results came back showing osteopenia, a mild loss of bone density. Her doctor prescribed alendronate. 3 months later, Linda had painful heartburn and jaw tenderness. She stopped dancing altogether. We recommended she stop the medication and switch to vitamin D supplements, resistance exercises, and a calcium-rich diet with sardines and leafy greens. 1 year later, she was back on the dance floor, stronger, steadier, and fracture-free. In short, for adults over 70 without a history of falls or fractures, bone health is better supported by daily movement, a nutritious diet, and proper vitamin levels, not just a number on a scan. Now let's talk about a scan that's even more worrisome, because it can lead to brain surgery. Test number 4, brain MRI for memory problems. It's normal to worry when memory starts to slip. The fear of Alzheimer's or dementia is very real, and often doctors will respond by ordering a brain MRI. But here's what many people don't realize. MRIs rarely provide helpful answers in these cases. They're detailed scans that show the brain's structure, but for those over 70, most results simply show signs of normal aging, slight shrinkage, or harmless white matter spots. The problem is, once these changes are discovered, they often trigger fear, additional tests, and sometimes even surgery, procedures that might not help and could make things worse. In 2021, Neurology Today published a review of over 3,000 MRIs from adults between 70 and 85 with minor memory complaints. A staggering 86% showed abnormalities, but only 3% were connected to something treatable. That means 97% of people were told something's wrong when, in reality, it wasn't serious. Even worse, about 12% ended up undergoing invasive follow-ups, like spinal taps or even exploratory brain biopsies, just from vague scan results. Consider Martin, a 74-year-old former architect. He worried about forgetting names and misplacing his wallet. His doctor ordered a brain MRI that showed white matter spots. Martin panicked, convinced it meant dementia. He stopped driving and isolated himself. His anxiety spiraled, but after a cognitive test, his results were normal for his age. We explained the scan findings were harmless. We focused instead on better sleep, staying hydrated, and playing brain games. Within weeks, his memory stabilized and his confidence returned. Bottom line, unless there are serious symptoms like seizures, sudden confusion, or rapid functional decline, MRIs usually aren't the right first step. A simple cognitive screening, done with paper and pen, is often more effective, more accurate, and much less scary. Now hold on, because the next test is one you may have already had. Test number 3, cardiac stress test. This is one of the most common tests older adults receive. Whether it's for general fatigue, chest tightness, or just feeling off, the stress test is often suggested. It tracks heart function while walking on a treadmill or with medication that simulates exercise. It's designed to spot blocked arteries, but in people over 70, especially those without clear heart symptoms, it often leads to unnecessary procedures that carry real risks. The issue? Accuracy. Studies have shown the false positive rate for seniors can be nearly 40%. That's a big problem, because false alarms lead to more invasive tests, like angiograms, or even stent placements and bypass surgeries that might not be needed. In 2017, a major JAMA cardiology study showed that over half of stents placed after stress tests were done in patients with no true benefit. These patients saw no improvement in lifespan or energy, but faced higher risks for complications like bleeding, kidney issues from contrast dye, and extended hospital stays. This was the case for Harold, a 75-year-old retired truck driver who walked daily. During a checkup, he mentioned getting winded on uphill walks. His doctor suggested a stress test just to be safe. The results were unclear, so he was sent for a heart catheterization. A mild blockage was found and a stent was placed. But Harold had a bad reaction to the dye used during the procedure, leading to kidney trouble. He spent nearly a week in the hospital and needed months of follow-up care. His energy levels never changed because the fatigue wasn't heart-related. He simply needed better hydration and more balanced meals. If you're over 70 and not experiencing signs like chest pain with activity or shortness of breath during light movement, a stress test may not be helpful and could lead you down a road of risky procedures. Safer options? A resting EKG or a coronary calcium scan. These tests are less invasive and provide helpful insight with fewer risks. Checkup number 2, colonoscopy. You probably didn't expect this one, but colonoscopy, a test that uses a long, flexible camera to look inside your colon, may not be the best idea after age 70, and in most cases, it's not recommended at all past 75 unless you're showing symptoms. That's because the risks rise as you get older. The prep process is tough. It involves strong laxatives that can cause dehydration, dizziness, or kidney strain. The sedation used during the procedure increases the risk of confusion or cognitive issues in seniors. And surprisingly, the procedure itself can cause complications, like bleeding, tearing of the bowel, or irregular heart rhythms from anesthesia. In a 2019 JAMA internal medicine study that reviewed data from over 1.3 million Medicare patients aged 70 and up, the numbers were eye-opening. For every 1,000 colonoscopies in those over 75, only 2 lives were saved, but over 20 people had serious complications. That's a 10-to-1 risk-to-benefit ratio. Even when small polyps are discovered, many are slow-growing and don't pose an immediate threat. In older adults, removing these may cause more harm than simply monitoring them. Take Carol, a 73-year-old grandmother who co-owned a flower shop with her daughter. She had no GI symptoms, no bleeding, no changes in her bowel habits, and no family history of colon cancer. But her new doctor, fresh out of training, strongly recommended a screening colonoscopy. She agreed. During the exam, a small polyp was taken out, and she was sent home. That night, she developed sharp abdominal pain and passed out. At the ER, doctors found a bowel perforation. She spent 9 days in the hospital, dropped 10 pounds, and hasn't fully recovered since. When we reviewed her records, it turned out she had already had 2 normal colonoscopies before. There was no real need for another. The U.S. Preventive Services Task Force advises ending routine colon cancer screenings at age 75 for most people. If you're in great health and still want screening, a stool-based test like the FIT test is a better choice. It's done at home, requires no fasting, no sedation, and catches most red flags. Talk to your doctor about safer options, because once you enter the colonoscopy cycle, it can be tough to get off the track. And now, the #1 most overused, dangerous, and unnecessary test for seniors, and chances are you've already had it. Checkup #1, annual full-body CT scans. Full-body CT scans, often advertised as part of executive wellness packages or upscale preventive services, are sold as a way to catch serious illness before it starts. But here's the disturbing reality. These scans expose your body to high levels of radiation. For older adults, especially those over 70, they're more likely to lead to follow-up tests, biopsies, and surgeries that never needed to happen in the first place. Even more concerning, there's no solid proof that these scans save lives in people without symptoms. Each scan exposes you to around 10 to 20 millisieverts of radiation. That's about the same as 500 chest X-rays. According to a 2023 study in JAMA Internal Medicine, increased use of CT scans may now be responsible for nearly 5% of all cancers in the U.S., on par with the cancer risk from drinking alcohol regularly. That means 1 in every 20 cancer diagnoses could actually be caused by the scan itself. That's not just ironic, it's terrifying. These scans often reveal small nodules, cysts, or calcifications that are harmless and part of natural aging. But the moment something unusual is spotted, doctors may recommend more tests, followed by fear, surgery, and stress. Let's take the story of Frank, an energetic 80-year-old who taught Tai Chi classes at the local community center. He felt great and signed up for a platinum senior checkup at a private clinic. His full-body CT revealed a tiny lung spot, just 3 millimeters across. That tiny finding set off a wave of follow-up testing. He was sent to a cancer specialist, then for a PET scan, and finally had a needle biopsy. The growth turned out to be benign, but the biopsy caused a partial lung collapse. Frank spent a week in the hospital and needed 2 months to get back to normal, all for something that likely never needed treatment. Leading experts now agree. Full-body CT scans should never be used for general screening in healthy seniors. The American College of Radiology is firm in its position. There's no proven benefit and serious risk involved. If you're having symptoms like weight loss with no reason, coughing up blood, or visible lumps, then focused scans on specific areas make sense. But scanning your whole body without a clear reason is like digging for treasure in a minefield. You might find something, but the cost could be too high. A safer, more practical path? Pay attention to how your body feels. Keep regular visits with your primary care provider. Only pursue tests that are clearly justified. Your time, energy, and well-being are too important to waste on unnecessary scans that might leave you worse off than before. So there you have it. 5 health tests that may do more harm than good after 70. Remember, always ask your doctor, what happens if this test finds something? Do the risks outweigh the benefits? And focus on what truly matters: staying active, eating well, and getting good rest. Have you or someone you know had an unnecessary test? Share your story in the comments. Thanks for watching.